Hello, friends. Welcome. I'm Susan Reese, and I'm an Associate Dean for the Quinlan School of Business, and I also co-chair the Academic Continuity Working Group. Today, we have more than 300 participants that pre-registered for our event, representing all three of our campuses. We are grateful for your attendance. During this webinar, we would like to address protocols and processes for all three campuses. As mentioned, this event is being recorded and will be posted to our Loyola's Return to Campus website in the next few days. This afternoon, we are going to hear about what Loyola is doing to create a safe campus, what Loyola's plans are for COVID testing and COVID protocols for the spring semester, the available technology and training to support all of you teaching HyFlex courses. And we are going to hear from several faculty members who taught on campus this fall and are going to share their experiences and perspectives. Please join me in welcoming our panel members for today. First, Dr. Norberto Grivatz, Provost and Chief Academic Officer. Phil Hale, our Vice President for Government Affairs. Kana Henning, Associate Vice President for Facilities. Maciek Nowak, Professor of Supply Chain Management and Associate Dean for the Quinlan School of Business. Joan Holden, Director of the Loyola Wellness Center. Keandra Wright, COVID-19 Care Coordinator. Dan Vonderheide, Associate Vice President of Information Technology Services. And the faculty members joining us today are Gajan Savandran, Wendy Gruel, and Gail Bora, who are all from the College of Arts and Sciences. After each speaker discusses a topic, there will be a question and answer period. Questions have been gleaned from those you have sent in during registration or have asked today in the Q&A. Questions will be directed to one of our experts on the panel and or answered by a team of volunteers behind the scenes. These volunteers will answer your questions as fast as they can. If your question isn't answered today, please submit your questions again in the Q&A during the webinar or email covid-19support@luc.edu at any time. We expect the webinar will conclude around 3 o'clock. So we hope you find today's presentations helpful and informative, and it is my pleasure to turn it over to Dr. Norberto Grivatz, Provost and Chief Academic Officer for Loyola University Chicago.
Thank you, Susan, and thanks to everyone for joining us today for this important discussion. This pandemic has called us to reimagine just about everything. Thank you once again for your commitment to your students and colleagues, and thank you for taking this time during a busy week to look ahead to the next semester. Like you, we want to have as robust on-campus presence as possible, and our plans envision a progressively larger on-campus presence each semester going forward. Nevertheless, as you are all aware, we are in the midst of a surge today, and that the best projections tell us will not relent until mid-January. We'll need to adjust, therefore, the beginning of the spring semester schedule to enable safe and manageable quarantine protocols on our return to campus, and are considering the options. One such adjustment being considered is to move most on-campus classes to online delivery for the first 2 weeks of the spring semester. To that effect, we are reaching out to faculty scheduled to teach on campus to determine any adverse impact delaying in-person instruction might have. And we will announce the decision in detail soon. But this approach is one straightforward way to accommodate the quarantine period and help to keep our classrooms and campuses safe and our community healthy. We will continue to work hard to communicate decisions as they are made and respond to questions you have today and going forward. In any case, as you hear more about today, we will also ask that faculty, staff, and students living off campus continue to follow Chicago's emergency travel order and the Cook County Department of Public Health recommendation for a 14-day quarantine for persons entering Chicago and suburban Cook County from COVID-19 hotspots. We are indebted to colleagues across Loyola's COVID-19 response groups for collaborating around the data that informs this kind of decision-making. It is not always easy, not as smooth as we would like, but the diligent work of many faculty, staff enables us to reopen safely and responsibly our three campuses in spring 21, or will continue to teach only online. The presentations today will furnish information, context, and clarity that I hope foster a degree of confidence in the safety of our campus spaces. And even if you are fully online and come to campus once or twice or not at all during the semester, there is still going to be valuable information today. Our panel will discuss in some details protocols for surveillance testings and plans for COVID monitoring, management, and care. We will survey what we have learned from other institutions, and some colleagues will talk about their experience during the fall semester. The hope is that we all learn more about our health and safety measures, navigating the changes to our work and classroom spaces, and the support, technologies, and training available whether you are working in person or online. So thank you again for your interest. Thank you for connecting today, and thank you for your deep commitment to your work and to our students.
Thank you, Provost Norberto. I would now like to invite Phil Hale, our Vice President for Government Affairs, to share what we've learned from other institutions. Phil?
Thank you, Susan. As Susan mentioned earlier, my day job here at Loyola is to manage our government affairs, federal, state, and local. But as part of our emergency response, I've also been managing our planning and intelligence section. Many of you may be getting our daily and our weekly reports. These are all available, by the way, via a SharePoint site that is open to everybody at Loyola. When we formed this new section last March, my first action was to recruit Dr. Elaine Morato, Dean of the Parkinson School of Health Sciences and Public Health, to the section. This is a public health crisis, and of course, she has just been invaluable as our subject matter expert. Our team for Planning and Intel also includes administrators and academics from all three of our main campuses. Our job is to gather intel on the pandemic, especially its impact on higher ed, and then make assessments, forecasts, and recommendations. We mainly gather information from public sources, including the mainstream media, websites, and other sources from other colleges and universities, and of course also official government sites such as the CDC and the Illinois and Chicago Departments of Public Health. We analyze the information that we gather and make assessments and operational recommendations. Starting back in August, we began to seek information specifically to inform decisions and plans for the spring semester. We chose 16 different universities to follow really closely, all of which were bringing back a significant number of students to their campuses this fall semester in the residence halls and for in-person instruction. These have included St. Louis University, Duke, UIC, and U of I Urbana-Champaign, Fordham, NYU, and Syracuse. We all chose because, like Chicago, New York State has had a travel quarantine, and we wanted to learn specifically from them. In early October, we made our primary assessment for next semester. And many of our recommendations are reflected in the return to campus plan. As we wrote this assessment, we had three core assumptions. The first was that for several reasons, a vaccine would not be widely available to most people, especially not to most 18 to 24-year-olds, at least not until late spring, April or May at the earliest. Therefore, vaccines would not be a factor for any of our plans for the spring. Secondly, based especially on data from the Institute for Health Metrics and Evaluation, we anticipated that we'd be in a winter surge, and we made our recommendations assuming that it would be peaking in mid to late January, right when we're bringing our students back. And finally, we assumed that Loyola staff and faculty are just as smart and just as capable as those at all of the universities that we've been studying, and what they can do, we can do too. So what specifically have we learned? Perhaps most importantly, we learned that colleges can operate safely in the middle of this pandemic with students on their campuses. SLU is a really good example. They have managed to maintain a positivity rate of around 1%, while the city of St. Louis has had an overall positivity rate north of 20%. We've seen what works at other institutions. And one of the things we've learned is that cases and outbreaks can be managed with attention to two key things. First, and you'll hear a lot about this, frequent testing of asymptomatic students, staff, and faculty, regular testing. Secondly, uniform compliance with mask wearing, distancing, hand washing. It works. In a communal setting, it works very well. We also have a much better idea now of where and how COVID does spread on college campuses. And overwhelmingly, contact tracing shows that at universities, COVID spreads off campus, both small and large gatherings. On-campus spaces, including classrooms that are carefully distanced, where people are wearing their masks, are not high vectors of spread at all. This is even true if someone who is contagious off campus becomes infected, but shows no symptoms, comes to class. Those classrooms are still not high vectors of contagion. Last Friday, the Chronicle of Higher Ed published an article, The 5 Biggest Lessons that we've learned about how coronavirus spreads on campus. And I was glad to read it because it very much affirms what we had already learned from the institutions we were following. And I highly recommend the article to everybody. Recently, we've noted that a lot of the institutions we're following are now doing everything they can for the spring semester to expand what they're doing on campus, particularly in the area of student activities. Students are clamoring for personal contact with one another, even if that contact is distant contact, and providing them with safe, structured opportunities on campus is a much, much safer alternative to letting them mix off campus in an uncontrolled setting. Finally, every university that has managed the pandemic well consistently stresses that we're all in this together. Each in their own way, always in the context of their mission, will stress that every student, every staff member, every faculty member plays an important role in making things work successfully on campus. And we remain very confident that Loyola will be just the same. So thanks for including me today. And I believe Susan will now introduce our next panelist. Thank you.
Thank you, Phil. Thank you so much. I'd like to now invite Kana Henning, our Associate Vice President for Facilities, and Maciek Nowak, Associate Dean and Professor of Supply Chain Management from the Quinlan School of Business, to speak about our campus preparations.
Good afternoon, and thank you for joining our webinar today. I look forward to sharing the plans that many members of the Loyola community have been working hard on for many months now. As Susan said, my name is Kana Henning, and in addition to being the Associate Vice President for Facilities, I am the Campus Continuity Section Chief of the university's Emergency Response Plan. And the working group that I lead and all of the sections that report into it are comprised of, among others, representatives from Faculty Council, the Research Enterprise, ITS, Residence Life, Marketing and Communications, my colleagues in Facilities, Campus Safety, and the Wellness Center. And while we call this a spring reopening, the truth is that we really never closed. We've had researchers caring for animals and continuing their important work. Students have been living in our residence halls, albeit at much smaller numbers than what we're used to. And faculty have been teaching in our labs and classrooms. So our plans for the spring represent part of our gradual and phased reopening.
Thanks, Kena. As Kena indicated, there are numerous individuals involved in getting our campus ready for the spring. As an aside, I did want to mention that before becoming involved in this project, as a faculty member, I viewed a lot of these campus operations as kind of a black box without knowing what's going in or out. But now having had a glimpse behind the curtain, I can say with some level of comfort that if any one person involved in these projects was not producing at 100%, I can say that we wouldn't be having this conversation about returning to campus. It's really been just so cool to see Loyolans from every corner of campus coming together, using their expertise to really work towards this common goal. I mean, who knew that this degree in supply chain management would actually become useful one day? But so when it does come to our academic spaces, which is one thing we want to talk about, the academic division of Kena's group is led by John Friend-Rice, who is charged with assembling a team that is responsible for ensuring that the spaces that we're using meet our health safety requirements, specifically our social distancing and capacity limitations. He's worked closely with our colleagues on the academic continuity working group to identify the appropriately sized spaces to meet our on-campus needs. That decision-making in turn was driven by recommendations from our epidemiological, public health, and healthcare colleagues at the health sciences campus. Then Peter Schlecht and his architectural consultant performed a number of studies across campus, laying out all of our classrooms with 6-foot social distancing bubbles to determine the appropriate and safe capacities of each space. Now, those studies revealed that we would generally utilize about 30% of the typical occupancy of the space, with some nuance related to movable versus fixed seating in classrooms and labs. Room assignments were scheduled to try to keep faculty who are teaching multiple sections in the same space whenever possible. We try to allow for open slots between classes to allow for more transition time, again, whenever possible. And then our colleagues who will be teaching in person are going to be asked to construct a fixed seating plan for the students attending class in person and to take attendance each day. Now, that will greatly assist in contact tracing efforts should any student fall ill. So as Kena will describe, these are just some of the components that we're going to have in place to keep you and our students as safe as possible.
So what else can you expect when you get to your instruction space? And first, the layout. As Maciek just explained, all of our room capacities have been limited to meet social distancing requirements, and any extra seats have been removed. We're putting 10 feet between the instructor and the first row of students in classroom spaces. And you'll see signage that at the entry to your classroom that lists the maximum capacity of each room. In our largest classrooms, we have identified single entry or exit only doors to the classrooms. And you'll also see markers on the floor where chairs and desks should remain. We're not allowing any room layout changes since these have been studied and specifically laid out to meet our social distancing requirements. You'll see signage throughout our buildings, which designate one-way stairs, floor markers and elevators, and entry and exit doors to our buildings to promote a safe flow of traffic. We also have sanitizing stations that contain hand sanitizer and sanitizing wipes within the entrance to each classroom. These are restocked and refilled each evening by our housekeeping staff. Something new that we're also going to be adding in the spring semester is an envelope in each classroom, and that envelope will have a flyer attached to the outside of it that lists all of the sanitizing products that we have available and the way to contact facilities if you need us. Inside that envelope will be a stock of disposable masks if you should need those. Again, all of those supply levels are checked and restocked each night. And you'll also start to see hand sanitizer throughout campus in elevator lobbies and common spaces like libraries, quiet reading rooms, and study rooms. We've also hired a mechanical engineering consulting firm to study all of our HVAC systems and building controls, and that's to help verify our ventilation rates, our filtration strength, and our outside air levels to make sure that they're appropriate for mitigating against the spread of COVID-19. We've already purchased and installed higher efficiency filters across our campuses, and those will continue to be replaced at our normal schedules with those higher level filtration rates. And we're modifying our fan schedules to bring in more outside air and improve that air turnover in all of our occupied indoor spaces. This has all been done under the guidance that has been set forth by the CDC, the Illinois Department of Public Health, and also ASHRAE, the American Society of Heating, Refrigeration, and Air Conditioning Engineers. According to the CDC, spread from touching surfaces is not thought to be the main way that the virus spreads, but our housekeeping staff will continue to clean our high touch point areas like elevator call buttons, bathrooms, door handles, and railings regularly throughout the day, and they'll be cleaning all of our occupied classrooms and labs each night. Faculty and staff and students should also practice our clean as you go policy, so you'll be using the sanitizing wipes that are provided in the classroom to wipe down your workspace before and after each use. And with the new 30-minute passing period between classes, this should provide ample time to clean workstations and to avoid choke point and congestion when moving between classes. There are many other mitigation strategies that we're implementing on our campus that contribute to our overall health safety plans. We'll continue to require and enforce our personal safety practices that you hear so much about. That includes social distancing, wearing a mask or face covering at all times, both inside and outside on our campus grounds. In the spring semester, we're also going to be rolling out a new Loyola Health app. And for those of you who have already been using our symptom checker, it will now combine both a symptom checker and a badge or a status symbol that you'll get each day. And each person will have their status will be updated that will indicate their compliance with completing the symptom checker, as well as their compliance with their testing program. And we have a team of student workers called building ambassadors. They've been hired to monitor our campus for compliance with our health safety practices. And those building ambassadors are authorized to ask to see any Loyolans health app at any time to ensure that they are compliant with all of our testing protocols and the symptom checker. And so I want to also let faculty know that you are welcome to ask to see this app from any student who's in your classroom. You may ask to see their app to confirm that they've completed their symptom checker, that they're not exhibiting symptoms of COVID-19, and that they are compliant with our testing protocols. We're also ensuring safety in the workplace by continuing to manage our occupancy levels, meeting our 25% maximum within the workplace to continue our overall campus dedensification during this gradual reopening. And finally, you're going to hear from Dr. Joan Holden about the university's new surveillance testing program, which is quick. It only takes about 5 minutes. It's easy. You get your test results back within 24 hours, and it's very helpful to our community. And having this testing resource available to us was critical to university leadership's decision to reopen our residence halls and to invite more of our faculty and students back to the classroom in the spring.
Kayla, thank you. I'd like to ask you a couple questions that we've received. First of all, are the recommendations for cleaning also recommended for the HSC campus?
Yes, all of our health safety practices, all of our cleaning protocols, our signage, our social distancing layouts, all of the measures that I just discussed will be are applicable to all three of our campuses. In fact, the health sciences campus really has, we've seen activity on that campus already in the form of research, in the form of classes taking place, clinical skills centers that have been in use. Our quiet study room and the IC have all been in use, study on that campus, and those have all been in compliance with our all of our health safety measures.
Thank you so much. Kana, would you please describe for the audience what a third space is and how those will be available to students, faculty, or staff?
Sure. So third spaces are anything outside of where you live or work or study. And so we would consider the information commons a third space, a space to get outside of the classroom. Damon Student Center, we have the Hallis Fitness Center and the Health and Fitness Center out at the Health Sciences campus available. We are also identifying many study rooms across campus to provide students an opportunity to get out of their room. We do recognize that many of our students will be living in the residence halls, but taking all of their classes online. And we want them to have another place to go to study while on campus. They can take an online class while on campus. We've identified rooms especially for that purpose. And we will have all of those third spaces available, again, with many of the same measures that you heard me describe in the classroom, removing extra seats to help reduce density, to maintain social distancing, and all of our mask wearing and cleaning protocols in place.
Thank you, Kana, and thank you, Maciek, for filling us in on all of the protocols regarding our classrooms. I'd like to now introduce and invite Dr. Joan Holden, our Health Safety Officer and Director of the Loyola Wellness Center, and Keandra Wright, a COVID-19 care coordinator, as they were going to talk to us about testing and COVID-19 exposure.
Thank you,
Joan?
Susan. Thank you, Susan, and good afternoon, everyone. As Susan said, my name is Joan Holden, and I'm a nurse practitioner and the director of the Wellness Center here at Loyola. I also serve as the health officer for the Management Policy and Command Team for Loyola's response to the pandemic. I would also like to share with you that since the very beginning of the pandemic, I have relied on the expertise of the Healthcare Advisory Working Group, consisting of a talented group of people who represent a variety of areas in our university and who have helped to inform the decisions made by the Management Policy and Command Team. The members of this group were on a slide at the beginning of the webinar, and we have been meeting very regularly throughout the pandemic. Their scientific expertise has been extremely helpful to the Management Policy and Command Team as we make decisions about keeping our campus as safe as possible. I'm delighted to be with you this afternoon to discuss in more detail the testing strategy we have put forth for spring semester. And as I mentioned in an earlier webinar, of course, the safety and well-being of our campus community is always our top priority. I also hesitate to say reopening plans since we never closed, but we think we can bring back a limited number of students to the residence halls and classrooms and do it safely. The Wellness Center has been doing testing for COVID-19 since August. We have continued to see students living in the surrounding community and employed a targeted testing strategy for high-risk groups. But we have not, up until now, had widespread scale to our testing capabilities. University leadership has been studying for months, as Phil said, the safest way to bring more students back to campus in the spring and to reopen our residence halls at reduced density. And we have learned that with good execution of two key areas, as mentioned before, cases and outbreaks of COVID-19 can be managed. And again, these two key areas are aggressive testing of asymptomatic students, faculty, and staff, and compliance with mask wearing, distancing, and other basic mitigation measures. With this in mind, we decided to implement a surveillance testing program at Loyola, which is critical to our ability to reopen. According to the Centers for Disease Control and Prevention, testing of asymptomatic students, faculty, and staff should increase the timeliness of outbreak detection and response by rapidly identifying and isolating COVID-19 cases that would have otherwise gone undetected without testing. We have agreed to a community partnership with Shield, Illinois, SHIELD Illinois is a screening, testing program and infrastructure that deploys the University of Illinois' innovative saliva test across the state. The benefits of using this test are that it is less expensive, has a 24-hour turnaround time, enables us to provide scale in our testing capability, is easy to use, and is highly accurate. Another benefit of using a saliva-based test is that it can identify virus in the asymptomatic individual, thereby helping to mitigate spread in a more expeditious manner. The saliva-based test is free. Each undergraduate student will be asked to test twice a week. Graduate students, faculty, and staff will be asked to test once per week. If you do not plan to visit campus at all in the spring 2021 semester, you will not need testing and you do not need to sign the consent form. This is true for all faculty and staff and students. If your plans change and you must come to campus, we ask you to submit to testing on the day you come, on the day you enter a campus building. To be more specific, if you plan to come to campus less than once a week or only sporadically, you should submit for testing upon arrival each time you come to campus. Although results will not be available within 24 hours, positive cases will initiate contact tracing to determine any potential close contacts you may have had while you were on campus. If you come to campus once a week, you should submit for testing upon arrival each time you come to campus and visit and go into a campus building. Undergraduates who plan to be on campus regularly in the spring should plan to submit for testing twice a week with 1 day in between tests. Faculty and staff who plan to be on campus regularly in the spring still only need to submit to once per week testing. Finally, if you are off campus entirely in the spring and you will not be coming to any of Loyola's 3 campuses, you will not need to test and you will not need to sign the consent form. And to further clarify, clinical faculty who do not visit the university's health science campus buildings will not be required to test. Testing will be available on all 3 of our campuses. I urge you to please visit our Return to Campus on a website for more information about our testing procedures for the spring. We have modified our compliance strategy as well, so I want to provide you with an update from our previous testing announcement that went out right before Thanksgiving. First, we will no longer require re-entry testing, meaning that you will not need 2 negative tests for your ID to be enabled with building access. Our testing sites will be open the week of January 11th, so we do encourage our community to begin visiting the sites during that week. However, it is not mandatory. Throughout the semester, we will manage compliance by monitoring who is on campus, how frequently they are accessing the campus buildings, and ensuring that those individuals are testing at the frequency that I described. In the event we find that someone is not testing but is still accessing campus, we will follow up with you and remind you of our testing program and the need to test. If you still do not comply with the testing, we will remove your ability to access campus buildings until you become compliant. Our residential students, however, will always have access to the residence halls. To be eligible for your first COVID-19 saliva-based test, you'll need to do the following things. Everyone needs to complete the COVID-19 prevention and awareness training via Get Inclusive. Read and sign your consent forms. Consent forms are needed to create the roster of people who will be tested and will also help us better understand our testing volumes. After signing your consent form, you'll receive an email with instructions for creating your patient account. This email will be sent to you shortly after the new year. Your MyShield account will allow you to schedule your visits to the testing sites and will be the portal through which you receive your test results. Everyone who's tested, regardless of frequency, needs a MyShield account. For more detailed information about our testing process, please do, including scheduling your visit, arriving for the test, the check-in process, locations, and hours of operations, please visit, again, our on-campus testing page of the Return to Campus website. And now I would like to introduce to you Keandra Wright, one of our lead contact tracers and COVID care coordinators, who will be explaining to you the especially important part of the process of contact tracing. Thank you.
Hello, everyone. Like Joan said, my name is Keandra, and I'm one of the 3 contact tracing leads, and I'm here to talk about contact tracing. So we have currently around 70 contact tracing volunteers working with us next semester. And as of now, there are 3 contact tracing leads who double as COVID care coordinators. Contact tracers are required to complete an online Johns Hopkins training course offered through Coursera. This training covers the basic elements of contact tracing, like how to engage in the conversation, decipher close contacts, and the general information about COVID care. They complete HIPAA training where they learn about the importance of health privacy, and then they will go through training with their leads where they learn about the specific requirements for our contact tracing process. We receive reports, like for that process, we receive reports via the COVID-19 report inbox. These reports are either self-reports, faculty or staff reports, where faculty or staff will report on behalf of their student or employees, or in beginning next semester, shield reports. One note about faculty and staff reports, if you plan on submitting a report for someone else, please let them know ahead of time. We call every positive case, and the process is a lot easier if the positive case knows about the report. Once we get those reports, we assign them to contact tracers. They have 24 hours to try to make contact with the positive case. Once they make contact, they start the case investigation. This step is just a conversation that contact tracers have with the positive case. We ask questions about symptoms, date of onset, and potential contacts. This is also the step where we might reach out to professors or instructors to talk about class seating charts and activities. Please make sure you're keeping an up-to-date record of in-person classes because that information can be vital to our contact tracing efforts. Also, this is when we might submit spaces to facilities to be taken offline for additional cleaning. Once this process is over, contact tracers report their findings back to the leads and we'll begin the contact notification step. For contact notes via the COVID-19 report box, notifying people of their contact status. This email will provide information about the 14-day quarantine period, where to get tested, and how to get a hold of the COVID care coordinators if additional support is needed. Like I mentioned before, all contact tracers go through HIPAA training to ensure personal information is always being protected. When we notify contacts of their exposure, we never and will never share personal information about that case. In the past, we've noticed that when people outside of contact tracers notify groups about positive cases and their contact status, it creates a wave of mass panic. To alleviate that panic, we ask that contact tracers be the only ones notifying people of their contact status. Positive cases should still reach out to their contacts to let them know, but official contact information should only come from contact tracers. That's contact tracing, and thank you.
Thank you, Keandra. I'm going to ask a few questions, and my first question is actually for Kana Henning. What is how does the app work in terms of privacy? And what happens if faculty are not comfortable asking students to look at their apps?
Thanks, Susan. Great question. Absolutely no personal health information, no PHI will be shared on that app. It will not indicate anything other than simply that access is granted, meaning access is granted to a building. And that is derived by compiling their reporting of their own symptoms and then their compliance with our testing program. It will not share any information about their test results, or their personal health information. It will simply say that they have, that they are able to access the campus because they are compliant with our testing program, and that they, and the symptoms that they themselves report on the symptom checker.
Thank you, Kana.
Thanks.
Joan, if I'm teaching at Lakeshore, can I still be tested at HSC?
Yes, you can be tested at any one of the sites.
Thank you. Are there any additional or different requirements for the primarily hospital-based faculty, especially if only on Loyola's campus for research?
No, as I mentioned before, if you're a clinical faculty and you do not enter the campus buildings, you are not required to be part of the testing regime.
Thank you. If we are teaching completely online and do not plan to come to campus at all during spring 2021, do we need to sign up for any testing?
No, you do not need to sign the consent form, and you don't need to sign up for any testing if you are going to be completely online and you will not be coming to campus in the spring 2021 semester.
Thank you so much, Joan and Keandra, for your insight into testing and contact tracing. I'd like now to invite Dan Vonderheid, our Associate Vice President for Information Services. He's going to talk about the classroom preparation and training for those of you teaching in the high flex training mode. Thank you. Dan.
Great. Thanks, Susan. Thanks for the introduction and thanks for the invitation to participate today. As Susan mentioned, I'm going to talk a little bit about the technology and the resources that will be available to our faculty who are teaching in the HighFlex course this spring. Just to kind of level set, in HighFlex, faculty are delivering their course to both online and in-person students simultaneously. Earlier this year, we were referring to this as dual mode, but have since adopted the industry term HighFlex. The technology we have in place to support HighFlex is first our standard classroom equipment, which most of you are familiar with, the workstation, a projector screen, audio for when we play videos and so forth. What we have added for HighFlex is a second larger monitor at the instructor's table to allow that faculty member to more easily see the online students. We've added a camera facing the front of the room for the online students to see the instructor. We've added microphones that will pick up the instructor and students for those students online. And we've added speakers so that everyone can hear the online students when they participate. We have just over 80 classrooms at Health Sciences, Water Tower, and the Lakeshore campuses that are being outfitted for HighFlex. You can see a list of these rooms in the ITS web pages under HighFlex Classroom. That link will be in the chat. As for teaching in the HighFlex spaces, we, ITS and the Office of Online Learning, have partnered to host several training webinars. These are 30-minute sessions where faculty will be introduced to three key areas. One, the technology in the classroom, how to effectively use Zoom in a HighFlex instruction, and strategies for engaging students both online and on campus. We currently have 2 of these dates scheduled for these webinars. The first is next Wednesday, December 16th, and the second, January 12th. There will also be recordings of these webinars available that you can listen to on demand. And if there's a need, we'll certainly add additional webinars if the demand requires it. We are also offering individual hands-on training with the faculty who want to go into the classrooms and actually step through the equipment that's going to be in their space. An email was sent out on December 3rd to those faculty members teaching in the spring. That message came from Kathy Chavez-Dominic from ITS, inviting the faculty to sign up for the training. If you are interested and can't easily put your hands on that email, you can simply contact the ITS service desk and they'll connect you with Kathy for you to connect and make that appointment. My last point on the technology. So if you're teaching in a HighFlex classroom and during your class you experience a problem with your technology, you can always dial *901. This will get you connected directly to a field technician who will be able to assist you. Susan, that's all I have for this afternoon. I hope that's helpful.
Dan, thank you. I think that was really helpful. Could you just address a little more the logistics of how someone will simultaneously broadcast the live lecture and be in class?
Yes. So if I understand the question correctly, right, engaging both on-campus students and online students is a little more tricky. You're going to have your in-class students and you're going to be running a Zoom session for your online students. I believe in a little bit we're going to hear from a couple of faculty members today that will talk about their experience from the fall, and they can probably speak a little bit to that as well. But that said, I just strongly recommend the faculty who are teaching in the spring to really take advantage of that 30-minute online session that will step you through part of that, the engagement portion, as well as the one-on-one on-campus training with Kathy. I think those two things, coupled with the services that are offered by John Gurnek and his team in the Office of Online Learning, they also provide great tips for how to be more engaging in a HighFlex environment.
And as a reminder, Dan pointed out that those trainings are starting. There's 2 December 16th and January 12th. And Dan reminded you how you can sign up for one-on-one training. In addition, work with your associate deans or with your budget managers to hire on-campus assistants to help you out. We've in ACWG, the Academic Continuity Working Group, as part of the emergency response plan that I co-chair, we have told all the associate dean reps that everybody teaching on campus, if they want an on-campus class assistant, to get those people hired through Handshake now, so that they can participate in training with you as early as December 16th if you hire them and get all that paperwork completed. So thank you so much, Dan. I'd like to invite our 3 faculty members, Gaj Savandran, Wendy Gruel, and Gail Barra, to share their experience with teaching on campus. Gaj, I think you're up first.
Great, thanks, Susan. Hi, everyone. Just to set some context, I'm an assistant clinical faculty member in the engineering science group. And the class I'm talking about today is our senior capstone class for the environmental engineers. That class has 9 students. We teach it in a 6-hour block on a Wednesday, and it's in the Flex Lab. To me, this was the ideal location to teach a socially distant class. It's a 10,000 square foot warehouse building with 20-foot ceilings, and there were only 10 of us in the place at any one time. So from a comfort level, it was nice as that first transition back onto campus. The class was offered in high flex mode, and all 9 students chose to be on campus. So we had all the students in there from the very beginning. A little bit more context, which might be unique to this class. This was a senior level class with a group of students that had been together since freshman year. So they've taken dozens of classes together. So they knew each other really well. And I'd also taught just about all these students at least twice, if not 3 times in other classes. So this was in an environment where we all knew each other fairly well, which is kind of unique. In terms of the way we kind of approach things, we weren't quite sure what was gonna happen as the semester went on. So from a syllabus perspective, I tried to move everything I could to the front part, knowing that we could lose access to being on campus at any one time. Things seem to be a little bit more predictable this semester, even though there's still some unpredictability. And feeling comfortable with flip-flopping what you do when, if you can, was something that I had to learn to deal with. The other lesson that we kind of learned early on, as a faculty in engineering, we discussed what kind of protocols and COVID information we should put in our syllabi. And in the end, we settled on just pointing students to Loyola's information because things change so quickly, and having to update your syllabus because other factors change with the city of Chicago or Loyola would just mean too much administration on your parts. So the class I taught was a 1-hour lecture followed by 5 hours of project work. One piece of advice that I think worked well: keeping students in fixed groups for longer than you normally would. And this allows them to get to know each other, get to know each other's COVID-related constraints. An example of this, one of the members had a housemate that was immunocompromised. Consequently, they wanted to be a little bit more on the risk-averse side. That meant things like site visits and other slightly higher risk activities. The other members of the group were more than happy to take those on and delegate other tasks to the member who couldn't. Sharing each other's context, including your own, with the students, I think allows them to really think about their role in the community and keeping everyone safe and healthy. So this is a capstone class. So it's a project-based class. So the first thing we talk about is project risks. And one of the things that popped up straight away was COVID. How are we going to deal with it, etc. So we kind of took this as an opportunity to be proactive, run through all the what if scenarios. What if we lose access to campus? What if we go online? What if one of our group members gets sick? What if someone has to self-isolate? And having the students work through how they would deal with those scenarios at least gave them a sense of control over that situation. It was a valuable exercise. It took about half an hour on the first day, and it worked out to be useful down the road. So at the end of week 4, right after class, or the day after class, one of my students informed me that they were feeling symptoms and they were going to go get tested. What I thought was, the way the student responded to this I thought was interesting. I was their first email, and their first instinct was to tell everyone in the class because they wanted to make sure everyone else was safe. And I think this is the kind of environment we want to build in our classrooms, a judgment-free, fear-free, guilt-free environment where students feel comfortable saying that, I think I'm sick, you guys should take care of yourselves. By Monday, it came back as a positive case. By Monday afternoon, the contact tracers had contacted 2 members in the class that were in her group, and they all started self-isolation. And that's the process we kind of went through. It was scary being the first case, but from my perspective, looking back on it, the one thing I took away from it was the protocols worked. Masking in class, wiping anything we touched before and after, the clean as you go protocols, they all worked. We all had 6 hours of exposure with this individual, and no one had a subsequent infection. So it gave me some confidence in the process, and moving forward into this semester, it also gives me some confidence there. It also opened the door, because it happened early in the semester, for students to self-isolate very, very quickly and freely. They would self-report what they self-defined as risky behavior. Like, I was out this week protesting, so I'm not going to come to class. I'm going to self-isolate. Or around the election period, I've been working at polling booths. I'm going to self-isolate. There was even cases of people who would self-isolate because they had contact with someone who had contact with someone who tested positive. And I feel like that kind of level of responsibility was made possible because that first individual was so open with the transparent process that they were going through, and the class took it in stride. From a teaching perspective, I started everyone in class. In the middle there, we went to high flex because there were people who were self-isolating, etc. And then after Thanksgiving, we were all online together. So we kind of went through that entire spectrum of teaching. And online, you can do well. We know how to do that well. In class, we've been doing that forever. We can do that well. High flex is hard. You are running 2 separate environments at the same time. And embracing the technology, I think, is the way to go. And meeting with ITS and getting that, I think, is getting the training would be very useful. For me personally, I've been teaching with a Microsoft Surface tablet with a pen. I moved away from the whiteboards and the blackboards. If on cameras, it doesn't pick up well, etc. Whereas annotating slides works for everybody. It also gave me the ability to just hit record if there was someone absent. They get, a narrated lecture with the slides, and that worked really well. And the last thing I would strongly suggest is constant feedback from your students. We only know how to teach one way. That's the way we're doing it. They're experiencing 5 versions of HighFlex from 5 different professors. So steal what's working for them in their other classes. They're pretty open with, like, this professor's doing this, could we do that? And I think getting that conversation going in your class from day one can be really helpful. Similarly, getting that conversation going in your faculties. We meet twice a week in engineering as a faculty, and most of our meetings were what's working, what's not, what's working, what's not. And that's how we can iterate towards something that works better for everybody. So that's all I had. So I'm gonna pass it off to Wendy so she can share her experiences.
Hi, everyone. Thanks, Gaj. So I'll give you a little bit of perspective on my courses. I'm in the forensic science program. All of our forensic science labs were on site. So we were a little bit unique that way. All of our full-time faculty members were teaching in person. For me, that meant I was teaching 2 sections of one class and 1 section of another. So I had 3 on-campus classes and 1 online. All of my students across the board, juniors and seniors, so I think similar to Gaj, that there's a little bit different expectation because these students know each other a little bit. And I had basically 3 points that I thought would be relevant to share today. So the first thing is planning and preparation. If anyone knows me, you know that I try to plan for every contingency, which we clearly cannot do. But doing that sort of kept me where I needed to be and not freaking out about everything. So think about your syllabus, think about all of the ITS resources. I met with ITS twice before the semester started to make sure I knew how to use the equipment and it worked in the space I needed. One of my labs didn't have internet access before that, so important things to try out. Keeping current on university policies. I know it's changing all the time, but you can't expect your students to be following those policies if you don't even know what they are. And then if you have department or program policies or approaches that you're going to take, because all of the faculty was going to be online and we wanted to have consistent expectations for our students, we coordinated our expectations and applied it to all of our courses. One thing that we freely admit, and I think most people would, is that lab classes are inherently different from lecture classes. Lab classes have fixed resources. So your students are going to be moving around the space, you're going to be moving around the space. So you need to be considering that as you're designing experiments. What can you cut out? What can't you? How do you lay out the lab in a way that maybe you didn't before? For me, that meant setting up sort of 2 staging areas where they would get all of their supplies and then go back to their own space and work. And lab capacity, of course, was reduced from what would normally be a 24 student lab to an 8 student lab. In my syllabus, I spent a lot of time figuring out what was flexible, what wasn't. If a student missed this, could they do the next part? Could they not? So I kind of had a plan in place for any given, in my mind, for any given scenario that might come up. Some labs are inherently more conducive to this because I had that one class that was a combo lab lecture. I sort of front loaded so that most of the lab was completed early on so that if we had to go online only, we still got the bulk of what we needed done, if not all of it. The second thing is, what are your expectations? So your first expectation should be, you're going to have to adjust to something. It might be COVID related. It might be the power outage that we had in LSB earlier this semester. So just be aware that you're going to have to be flexible and then communicate whatever those expectations are to your students. So one of the big things that I did is I addressed everything in my syllabus in terms of what I expected. I expect you to come to class because we are offering this in person because of the inherent complexity. However, I expect you to not come to class if you are contagious or risky. And I expect you to let me know that as soon as possible. If you wake up at 7 o'clock for our 8:30 class and you feel terrible, don't come to class. Just email me and let me know, and that is totally fine. I would rather have that than have a student come in potentially contagious or not feeling well and have that issue. And then the expectation that they will follow university guidelines. Some of my students did not know on the first day of class that we had an app and a symptom tracker. So, getting that information out there and explaining it to them, and then also letting them know that it applied to me. I was not going to be bringing anything in, and I was not going to be expecting anything from them that I didn't expect of myself. And I think this speaks to the point that we've kind of been speaking about a lot. Like, we're all in this together. The same ideas that we talk about in building community and online classes, we're now talking about building community in these in-person classes that are unique because of the social distancing and other requirements. But if you set the tone for that early in the semester, it really will apply throughout. And so no matter what your expectations are, third point here, reality. The reality is going to be different than what you expected. But in all honesty, the first thing that was interesting to me is that I found student compliance with university policy very high. Whether I was walking around campus, walking to campus from where I parked, what have you, students are masking and social distancing, and not just in the classroom. I had a day where I opened up the door to my classroom and I had a line of students going down the entire hallway because they were all masked and socially distanced without me having to prompt them. You will have absences and other weird, unexpected events. And I think we've sort of conditioned ourselves to think that it's all going to be COVID related, but it's not. No matter how well I planned, I came up with a scenario, I got hit with a scenario that I hadn't planned for, and a student actually needed to isolate for the last 2 weeks of on-campus classes. And by the time she was able to come to campus, we didn't have enough time before campus closed to reschedule it. It's fine. I worked with her. She's getting an incomplete in the class, and we're going to address it early in the spring. And then similar to the physics department, we as a forensic science faculty were always in communication. Part of that is because we were always on, a lot of us were on campus, but also, we worked through that too. Ours were a little more informal. And then my big take home is that it was a really unique experience being on campus, and especially for as many classes as I was. But I would say it was definitely an overall positive experience. Students were glad to be there. They were willing to follow policy. And as long as you get used to calling audibles in the middle of the game, you'll be fine. And I think Gail Barra has a few things to say as well.
Thank you, Wendy. Hello, everyone. I'm Director and Professor of Engineering Science, and I'm going to describe some tips that I've learned from teaching HiFlex this semester, and then I'll talk about my particular course. So first of all, teaching next semester starts now. You need to email all your students and find out who are going to be on campus and who are going to be online. And you can use that email to set the tone, let them know you're all in this together, you're all working together to have a successful course. Pre-arrange your breakout rooms for your group work, and so your online students don't feel isolated, put them in different groups so they're not all together. Ask the students who are going to be on campus to bring a laptop if possible. So Kathy Chavez Dominic has been offering classroom equipment training, and she is fabulous. So sign up now, and if you are using a tablet, you really need to practice using that pen. Before class starts each time, you're going to have to be more organized. So you're going to have to upload your slides, your handouts, your video links to Sakai so that your online students can follow along during the class. Each student who is in the classroom is going to sit at a pre-assigned station or chair, and you're going to be sitting or standing at the instructor's station. You're going to have to position this camera towards you, which is going to limit your movement. And you're going to have to remember to speak much louder than usual because you'll be wearing a face mask. To minimize echoes in the classroom, have everyone wear headphones, and so the students can speak and you don't hear that echo while you're teaching. And you're going to have to remember to wipe down surfaces when you first get to your instructor's station, and then at the end you'll wipe it down again, but also the cart, which has the camera, the remote, and the microphone. Always remember to ask for student feedback, both from your students who you see in the classroom, but those who are online. And have a sense of humor because something is definitely going to go wrong. If you teach for 6 hours at a time, I do this once a week, you're going to get maskne. And if you don't know what it is, you will soon. It'll probably happen during your first week as your skin gets used to the face mask environment. Students are really grateful to be on campus, and they're going to work with you to improve your classroom environment if you ask for their feedback. And as Gaj said, talk to other faculty members who are teaching HiFlex to commiserate and learn tips. In engineering, we have faculty meetings twice a week, and I've learned a lot of tips from my faculty. So my fall course was Engineering 381. I was able to arrange for all 3 engineering capstone courses to be taught on campus this fall. And when we asked the environmental engineering students, they are all coming back to campus. The computer engineering students, they were coming back to campus. But of the biomedical engineering students, only 4 out of 6 came back. So I arranged the group so there was 1 online student of 3 in each group. And during 6 hours of class, 5 hours are devoted to working on their industry-sponsored project and teleconferencing with their sponsor. It's only the first hour that's actually the course meeting. And since all engineering courses are taught with a minimal lecture style, there's a mini lecture that we start with, and then the remaining time is devoted to group work. So let me show you what our classroom looked like. So this is the capstone lab within the Flex Lab, and in the back here, those are the 2 rows of desks where the students usually sit for the mini lecture. And then when we go to group work, if the group work is problem solving, they can stay in those 2 rows. If it's some other kind of activity, then they go to the front rows where they're building their capstone projects already. And here on this particular day when UMC took photographs, they were working on a human factors activity with infusion pumps. So you see in the first group, here is Sebastian, here is Priyana, and here is their third group member. This is Shalaka. So she's in the breakout room, and you notice that Sebastian has positioned the camera so that Shalaka can see what he's doing with the infusion pump. And so here's the second group. I'm talking to Michael. Behind him is Maya. And in the breakout room is Shannon. Notice Shannon is smiling. Shannon is happy that she's still able to interact with her group members. And the classmates on campus are happy because they're still in this shared space in the classroom. So take advantage of the students' goodwill and use this for continuous improvement of your course. And I believe when you do this, you will be on your way towards a successful spring teaching semester. Thank you.
I would like to thank Gaj, Wendy, and Gail for giving us all insight into what it was like in the classroom in the fall. And I hope those of you who will be in the classroom in the spring got some good tips from them. I would like to invite Provost Norberto back for his closing remarks.
I couldn't quite hear the end because of a problem in my computer, but let me begin by thanking Wendy, Gaj, and Gail for your valuable perspectives on ways we can navigate this period, manage our classrooms, classes, scholarly work, virtual spaces. I love Gaj's description with how to deal with the protocol and how effective the protocol was to give the students confidence on the class. I love especially when this calling audibles idea. I think it is important in this time to be able to have flexibility. And her examples are excellent on this. And of course, Gail's need of sense of humor and taking advantage of the goodwill of the students to improve our classes. So I think this was a really great presentation. And again, Wendy, Gaj, and Gail, thank you so much for what you have told us. I'd like to thank all the panelists for sharing their time and expertise and for their leadership as we care for our students and community. I encourage all of you that are in this webinar to stay in touch with the latest information through our COVID-19 and Return to Campus websites. Please continue to post questions there or communicate directly to your chairs and deans who can serve as a conduit. As Susan mentioned, we are recording and posting this webinar for viewing. And so I guess this will serve as an asynchronous learning for us. In this case, it's a good terminology. We will be holding more webinars for students and family. December 16 will be a webinar on important information on residence life. December 20 will present on the academic experience. Watch your emails and other channels for more details. So I'm grateful for all of you and for the mission we share. Please stay healthy and safe, and see you soon. Thank you.